Welcome back. I have the pleasure to introduce to the studio Marusha Gornar. She's another EIGE expert. She's the head of research and policy support unit at EIGE as well, and she will present us the findings of a survey on unpaid care. As I mentioned before in my introduction, this is a very important topic and one on which we sometimes lack the data. And this year, for the first time after 7 years, EIGE could update the time domain. So I'm very happy to have you here, Marusha, and you have the floor.
Thank you very much, Frederica, and welcome to this session. The title of my session is Time for a Change. So I will speak about the importance of care and what kind of change or changes we need to create a more gender equal society where women and men can prosper in all their diversity and throughout their lives. And as we know, care is a fundamental aspect of our lives. Throughout the life, we will either provide care or we will require care. So, and as we know from the data and experience, the care is also highly gendered, as women still take the biggest share of care responsibility in the families. However, as it was already mentioned before by Jolanta in her presentation, men are starting to be more involved in care. At least they show higher willingness to be engaged. And that also means that they do face certain challenges when it comes to work-life balance. And as Frederica said, we will here today look into some of the key findings from our EIGE's unique survey on care inequalities, on gender inequalities in care. And more specifically, we will look on the socioeconomic costs of care, what kind of role formal care services play, and also we will look into impact on gender equality at large. Care has socioeconomic costs, but also has the opportunities. Unfortunately, these costs are more felt by women, especially if we look more closely into employment, working time of those who provide care, as well as work-life balance tensions. First, let's look at the employment and working time of carers. Unequal sharing of care responsibilities between women and men is a significant contributor to gender equalities in the labor market. Having to spend more time on care responsibilities, it limits professional and career advancement, economic independence, as well as it impacts work-life balance. For example, when we look at the childcare, less women than men tend to be employed, and also they more often work part-time, especially when it comes to long-term care. These implications to career and financial prospects, financial independence are even bigger. And it's also a fact that those women caring for children are more likely to be stay-at-home parents, and they take this as their main occupation. They see that this is very intensive work. We have 11% of women and only 1% of men who are full-time stay-at-home parents. And when it comes to long-term care, we see that part-time rates among both women and men are higher, and this also means that this type of care is intensive and requires time. I said that intensive care does influence also our work-life balance opportunities, as it requires significant time, physical and also emotional efforts, and that does impact our opportunities in the professional life. And as we can see from the graph, more than a third of women and men with children under the age of 12 do experience difficulties when they combine paid work with childcare responsibilities. And it's even, this data is even higher for lone parents, as nearly 4 out of 10 lone parents experience such tensions. And when we speak about long-term care, the difficulties are even bigger. And this also hints towards very high demand of such care, and also issues in accessing formal long-term care services, and we come back to that a little bit later. Let's just look quickly what kind of impact the childcare and long-term care has on professional life of women and men. We see that more women than men, especially mothers with young children, had to reduce their working time due to care, and also had less time for career and studies. And this confirms a persisting trend, also gender norms, societal expectations, that it is generally mothers who are under heavier pressure to adjust their working lives to care demands. And of course, this has a negative, detrimental effect to their job prospects. What can we do to lift the care load? So, first thing is accessibility of services. This is a key. Then formal care services do alleviate the burden of informal care. They facilitate a healthier work-life balance for working women and men. And they also provide professional assistance and care. And high quality and affordable long-term care, formal long-term care, is also important since it empowers older people by helping them to maintain their autonomy and also live in dignity. So that's a very key element as well. And according to our data, 6 out of 10 parents with smaller children under the age of 6, do use childcare services, and they most commonly use it up to 3 to 5 hours per day. And with the provision, we see with this data that with the provision of services, the intensity of care reduces. And same goes also for long-term care services. So 6 out of 10 long-term carers do use care services, formal care services as well. And there is a difference between men using this kind of services between women and men. Men tend to use such services a bit more often than women, and on average that can be connected to their better financial situation as well as prevailing gender norms. Let's look at some data. This slide illustrates the relation between use of formal care services and the intensity of informal care. So when we look at the child care services, effect is particularly strong for mothers of children below 6 years. And amongst those who do not use the child care services, nearly half of them is caring for more than 10 hours a day. And notably, the share of fathers who provide such intensive care is much smaller, as we can see from the data. And similar trend goes also for long-term care. So, but here the effect is equally strong for women and men. Just very quickly to confirm this data, let's look at the country level. We see very clear picture that in those countries where more parents use formal childcare services, less they are less intensively engaged in these care services, in providing care. And the same trend is visible for long-term care services. Where the long-term services are used and available, the intensity of informal care is lower. When we talk about provision of formal care, we also see that there are certain unmet needs for such care. Despite the clear benefits of formal care provision, our data shows that significant share of women and men and also care recipients struggle to access all the formal care services they need. For a quarter of carers, for the long-term care services are not accessible. That is quite a striking number. And what are the main reasons for these unmet needs? Both parents and those who need long-term care, they name affordability, long waiting lists, unavailability of required services as main reasons. So long waiting lists are the main reason when it comes to childcare services, and affordability is the main barrier when it comes to long-term carers. And here we also need to look at a little bit at the urban-rural divide. Carers residing in sparsely populated areas in rural or remote regions, they have even bigger difficulties in accessing affordable services. This sector is generally facing increasing demands, but it's relatively underdeveloped in many countries. And here we see that the main reason are patchy and limited social protection coverages for the long-term services in different member states. And let's talk about benefits. From the previous slides, we saw that the formal care services might help to alleviate the care load. And we have done at EIGE an analysis, so-called probability modeling, which shows the relation between the use of services and the possible benefits for gender equality at large. So our analysis shows that investments in formal care services increase probability of gender equality overall, and more specifically in two domains, in the domain of work and in the domain of money. So those countries with higher use of formal care services have also higher probabilities to have high scores in these domains and also in the overall gender equality index. So the likely effect behind that is quite straightforward. We can make a connection. Reduced care obligations or care load leads to higher participation of women in employment, results in their higher incomes, and this has positive impact for gender equality as also measured by gender equality index. And to conclude, which can be the 3 steps forward at the European as well as national levels? So we know investing and funding for formal care. Let's strengthen it, earmark and increase. This will improve quality, accessibility and affordability of care services. Data is very important. Let's collect EU-wide gender statistics on different types of care, work-life balance, access to formal care services, and set ambitious targets when it comes to services. And apply targeted measures to challenge traditional gender roles. Let's actively promote equal sharing of caring responsibilities between women and men, equal engagement in paid work, and for both women and men, and contributing equally to society. And We do have a legislative and policy framework for all that in place. We have objectives of Work-Life Balance Directive, of the European Care Strategy. So let's make sure that all these objectives are integrated into relevant policy initiatives and also frameworks, both at the EU and the national levels, and that we set the budget aside for these important investments in long-term care. And of course, monitoring, evaluation of this progress is of the utmost importance. And let me just finish with a quote of this year's Nobel Prize winner and a professor of economics, Claudia Golding. We are never going to have gender equality until we also have couple equity. Thank you very much.
Thank you very much, Marusha. It was extremely interesting to hear about things that are so close to us. I mean, but you said that one of the key solutions to alleviate the burden on informal carers is to strengthen the formal care sector. But now, you know, we have experienced the COVID-19 pandemic. I mean, we know that their conditions are not exactly excellent. So what does the report say about the formal care sector and their gender inequalities, and what can we do to help them as well?
In this particular survey, which I was presenting today, we did not look into employment conditions of carers in formal care sector, but it comes from the evidence of other studies. And as you have mentioned, the COVID-19 pandemic has revealed the situation and also conditions in which the formal care providers work, and they have to work. And we can't talk about care sector without or caring without also looking into indeed working conditions and situation of carers. We know that care sector is highly female dominated. It is 3/4 of employed are women in this sector. And especially when we look at, let's say, less qualified professions or personal care workers, there the share of women is even higher. So it comes to even 95%. And we also know that part of the care sector goes unregistered. It's in this kind of gray zone. So in such conditions where also the work itself or the sector is not valued, we know that workers, especially women, are then facing low wages, low recognition of such work, also harassment cases, heavy workloads, stress connected with the work, and high tensions when it comes to also mental health. So that's important. That's why it's important that this sector gets additional funding. It is recognized as part of our economies, and it may then also attract more young men into these occupations. We heard before, I think Jolanta was also mentioning that this sector is not attractive for young men as an employment opportunity.
Yeah, absolutely, thank you. And maybe very briefly, as I believe we don't have so much time, but maybe if you could tell us very briefly, why is it so important to talk about the energy transition in care? Like, where are the linkages there? We know that with climate changes and also with demographic changes, with our aging societies, there will be higher and higher demand for different care services, be it when it comes to child care, care for elderly people, people with disabilities, if we are to invest into care sector more, this sector also needs to respond to environmental challenges and environmental changes. So that's important. That's why it's important that investment
usually it's public or private-public investment in this sector, is also green when it comes to infrastructure, when it comes to how they operate, how the facilities are let's say, contributed to carbon neutrality and so on. This is one element where the linkages are. When we look at the unpaid care or care provided, informal care provided in household, there we also see a bit different patterns when it comes to green-friendly behaviors. Women are slightly more likely to be sensitive to sustainable practices and apply sustainable practices in care and in household activities. They are slightly more prone to recycle and go for more eco-friendly products when it comes to food or cleaning. And men tend to resist slightly more likely this kind of practices. It can be also connected very much with gender stereotypes, that this kind of behaviors are seen as less manly as maybe society is expecting from them.
Okay.
So,
the famous eco-gender gap. Okay.
Exactly.
Thank you so much, Marusha. And now we have a break of several minutes, and we will come back with our panel discussions.